This meeting has been convened to consider the Health Service Executive Governance Bill 2018. The primary purpose of this bill is to amend the Health Act of 2014 to provide that the HSE shall be governed by a board and that the Executive shall have a Chief Executive Officer accountable to the board. I would like to welcome Minister for State Catherine Byrne and your officials who are going to take this bill. As there are a number of related proposed amendments, groupings arise and copies have been distributed to members. The following amendments have been grouped for debate: 1 to 8, 8 to 15 inclusive, 18 to 20 inclusive, 22 to 24 inclusive, and 26 to 28 inclusive. They will be discussed together. 2 and 4 will also be discussed together, and 5 and 6 will be discussed together. I will now go directly to the bill, and there are 29 sections, I think, of the bill. Yes, so 34, is there? Okay. So we'll move to section 1 of the bill. The question is that section 1 stand part of the bill. Is that agreed? Agreed. Section 2. The question is that section 2 stand part of the bill. Is that agreed? Agreed. Section 3. The question is that section 3 stand part of the bill. Agreed. And section 4. That section 4 stands part of the bill. Is that agreed? Agreed. In relation to section 5, there are a number of amendments. Amendment 1. 8 to 15 inclusive, 18 to 20 inclusive, 22 to 24 inclusive, and 26 to 28 inclusive are related. 9 to 15 inclusive and 26 to 28 inclusive are consequential on Amendment 8. 19 and 20 are consequential on 18, and 1, 8 to 15 inclusive, 18 to 20 inclusive, and 26 to 28 inclusive will be discussed together. So we will now move to amendment. Ask the Minister to move. Oh, Minister to move? Yeah. So we will now move to Amendment 1 of the bill. In the name of the Minister.
Thank you, Chair. Thank you very much. And just to thank the committee, and just to introduce Bernie Ryan and Dr. Ronan Glynn from the department as well. And thank you for having us here this morning. We're delighted to be here, and on behalf of Minister Harris, to thank the committee for providing the time for us to debate the bill. The bill is an important step on the journey and strengthening of the government's framework to the HSE. It's a priority for Sláintecare and it's a priority for this government. The public appointment process has taken place, and select board chair of Mr. Kieran Devan and 8 other members of the new board, including Deputy Chair Professor Deirdre Madden, has been selected. And I welcome the support received on this bill in the Senate and in the Dáil, and look forward to the discussions. And again, apologise that the Minister couldn't be here this morning.
Thank you. Are there any comments on Amendment 1?
Take all the amendments in this group together? Okay.
Can I just open on Amendment 1?
Yes, Minister, yes.
Thanks very much. I want to speak to the amendments 1 to 8, 15 to 18, 20, 22 and 24, 26 and 28 together. The substantive amendments are amendments numbers 8 and 18, and they are concerned with the strengthening role of responsibility of the board and the CEO. The other amendments are consequential amendments. I would like to start by outlining Amendment 8, which is a new function to the board. Firstly, the board must be satisfied an appropriate system, procedures and practices are in place to future the HFC objectives. This is crucial, as under the Health Act 2014 and the HSE objectives, it is used the resource available is to be the most beneficial, effective and efficient manner to improve, promote and protect the health and welfare of the public. Secondly, the board must ensure the appropriate system procedures are practised and in place for internal performance management and accountability, again, which are all very important. These systems must cover how the HSE performance functions under the Health Act 2004 and how HSE achieves those objectives in accordance with the HSE corporate plan, and how the HSE delivers the health and personal social services in accordance with the Health Act 2004. This will These will be all covered with the HSE-enabled compliance with the government's of ministerial policies where set out in codes of general line of the document. Amendment number 18 provides that for the CEO's role, the CEO must ensure that these appropriate systems, procedures and practices are in place. The board requirements to satisfy itself and appropriate systems are in place is therefore mirrored by the requirement on the CEO to ensure that the systems are put in place. The intention under the amendment is in this very way to state roles and responsibility appropriate. I should add that in addition with the provision, the Minister outlined Amendment 8 will be also placed as responsibility on the board to ensure the establishment and implementation of appropriate amendments to manage the CEO performance. Amendments number 9 to 15 and 26 to 28 are technical amendments to the bill, arising out of amendments proposed in relation to the functions of the board and amended section references. Amendments number 1, 22, 23 and 24 are also consequential to the substantive amendments. Where referring to the government or ministerial policies, the language in the amendments refer to policies where set out in code, guidelines or other documents. Amendment number 1 and 22 to 24 are consequential amendments from the wording in Amendments 8 and 18. The aims of these amendments is to ensure consistency of language throughout the Health Act 2004 and reference is made to ministerial and government policies.
Thank you, Minister. Now, members, any response? Yes, Deputy O'Reilly.
Thanks, Chair. Minister, in relation to amendment number 18, and I'm looking at B23, I think it is, so it's basically the last line. It's delivery of health and personal social services in accordance with this Act. Minister, it strikes me that that's a bit of a shift of responsibility, and I'm open to correction on this, but that shifts a lot of responsibility off of the shoulders of the Minister and onto the Chief Executive / Director General. And I would have a concern on that because, to me, it conflicts with what's in Sláintecare, because what's in Sláintecare really seeks to shift a lot more responsibility or maintain responsibility with the Minister, and I would have a concern. I'll be opposing Amendment 18 purely and simply because of that line. It strikes me that it is counter to what's in Sláintecare. And if I'm misreading it, correct me please, but it kind of, that's how it appears to me. And with regard to Amendments 22 to 24, can you just go into a little bit more detail and just explain in exactly why those amendments are necessary? Because it seems a bit of duplication to me, if you wouldn't mind. Thanks.
Okay. That's 18, is that what you said?
Amendment 18 and then amendments 22 to 24.
Okay.
Please.
Okay. Right, well, to refer back to one, the HSE is responsible for the operation issues and changing. Minister is responsible. Sorry. Oh, yeah. Minister is responsible for policies. And just on that, CEO must ensure that appropriate systems are in place, and the board must satisfy itself that the systems are in place. Strategically, from a policy perspective, the legislation will now require the CEO to put in place for the HSE systems and procedures for internal performance management and accountability. This is a new legal requirement and must ensure that the HSE puts in place not just a performance management framework that monitors the implementation and delivery of the corporate plan and services, but also sets out accountability systems it will put in place to ensure senior management is answerable in the terms of achievement of these plans. The aim of the technical changes of the amendment is to ensure consistency of language throughout the HSE Act for 24 and referring to the government on ministerial policies. Policies are policies where set out in code, guidelines and other documents or combination of documents. The need for these technical changes arises in Section 7 of the Health Service Act 2004. Section 29 of the Act Corporation Plan and Section 31 of the Act Service Plan. And just Bernie, just give me a little bit more information. Sorry. 22 and 24 are drafted amendments to corporate plan, service plan section. The amendments just add text to the description how the policy can be looked at, for example, in the documents of codes. I've nothing further to add on that, Chair.
Sorry, yeah, just on that, if we could just go back to Amendment 18. So, I'm not trying to be awkward, but it just does seem to me that conflicts with the stated aim of Sláintecare. So we have the appropriate procedures and practices that are in place, internal performance management and accountability of the executive. See, that to me looks like it shifts a little bit of responsibility away from the minister where it should be, and a lot more responsibility onto the staff who don't set the ministerial objectives, but then are left holding the can if those aren't achieved. And like so much of this is resource dependent. It just strikes me as unnecessary, but also that it runs counter to what we're trying to do with Sláintecare.
Sorry. Okay, thanks Bernie. Just to read what Bernie's given me, working on implementation of Sláintecare, the board is accountable to the Minister. The HSC requires to implement the government's policies and which is a system with Sláintecare.
Thanks, Chair.
Okay, Deputy O'Reilly. Anybody else wish to contribute?
My own ignorance, Chairman, on 16, to delete by the Minister and substitute by the Board with the approval of the Minister given. That's an unusual use of the language, I would have thought. Does that mean with the prior approval of the Minister or with the approval of the Minister post the decision?
Sorry, Deputy, we're not discussing 16 at this moment.
We're not on 16.
Oh, sorry, my apologies.
Okay.
Any other?
Including the rule. Yeah, sorry about that.
Any other contributions, Deputy Donnelly?
No, thanks, Chair.
No. Okay. So the question is that this new section be there inserted. Is that agreed? Thank you. We now move to amendment number 2, again in the name of the Minister. 2 and 4 are related and will be discussed together.
Thanks.
Minister to move.
I move. Yeah. Amendment number 2 and 4 relate to the health needs assessment, and I'd like to begin by thanking the committee for facilitating discussions on these. Health systems across the world are faced with rising demands for healthcare, increasing inequalities and health limited resources to address their needs. If, as envisaged in the Sláintecare report, we are in improving improvised population health planning and deliver more effective and integrated care, we will need to prize to design and deliver the new model of care on best national and international evidence and make an appropriate use of all the available data sources which are informed service planning and provision. A health need assessment is a systematic method of identifying unmet health and healthcare needs of a population, identifying the changes required to meet these unmet needs. The intention of the health needs assessment amendment is to provide for a more strategically targeted, beneficial and ambitious approach to such a study that is currently the case. This will ensure that the health service system becomes more responsive to the dynamic and changing nature of population healthcare needs and ensure, as proposed in the Sláintecare report, that addressing the social determinations of health become a guidelines principle in the design of the healthcare system. The amendment provides for the Minister's directions to use in the HSE will require them to conduct evidence-based scientific, strategically or systematic analysis with a view to bring about change beneficial to the health of the population. The scope and time frame of conducting any such assessment will be included as part of this direction. Provision is also made for the development of guidelines which will inform how assessments are to be conducted and for supplementary decisions to be issued in circumstances where the contents of any assessment report may be needed to prove prior to the publication. The finding of assessment reports will be published by the HSE on its website. Will I continue?
Yes, Mr.
Yeah. The purpose of Amendment 2 is to include provisions for ensuring of the ministerial direction for the conduct of health need assessment in the of Section 10 of the Health Service Act 2004, which covers ministerial direction more generally. Amendment 4 provides for the new section to be included in the bill, which inserts a new Section 10AA in Health Act 204, addressing the details of how the ministerial direction relates to health needs assessments will be operated in practice and implementation of such directions and related matters. Subsection 1 provides that the direction related to health needs assessments and the issue by the minister must include details as to specific requirements to be taken in consideration by the HSE when conducting the assessments that is the subject of the direction. Subsection 2 provides for details as to type of requirements that must be taken into consideration for inclusion in the directions. And subsection 3 provides for consultation by the Minister with the Minister for Public Expenditure and Reform and other persons as appropriate prior to ensuring a direction. Subsection 4 provides for the submission of a report on the finance of the health need assessment by the HSE within such time frame as the Minister may specify within that direction. And subsection 5 provides for approval of any such report within a period of 1 month after its receipt of the issue of supplementary direction to address any defects in the contents of the report after it has been submitted. Subsection 6 provides for the publication of the report on the Internet, and Section 5 provides for the development of guidelines by the Minister with a view to facilitating the conduct of health assessment by the HSE, and subsection 8 defines the terms health needs assessment for the purpose of this new section.
Thank you, Minister. Deputy Donnelly.
Thanks, Chair. Minister, two questions to start. One is, would you outline when a health needs assessment would be used? And secondly, in paragraph 2, it says, without prejudice to the generalities of subsection 1, the specific requirements referred to may include essentially the following. Can I ask why those ones? And are these simply advisory as a suggested list of things that might be considered?
Thanks. Okay. On question 1, it has to be done at least annually to inform the service plan. And on question 2, specific guidelines have to be developed. And the criteria that they will come into the health need assessment.
So the health needs assessment is an annual analysis that feeds into the HSE service plan. Is that right?
Yeah.
And at the moment, does it include the items listed A to F?
Do you want to answer? At the moment, it's not done. Deputy Dundee, at the moment.
What's not done?
The need assessment.
A health needs assessment is not done.
Yeah.
Okay, so it doesn't exist at the moment.
No.
When will it exist?
From next year.
And is that under new legislation?
Yeah. Will be. Yeah. Beyond
It's
it.
from this legislation it will be done. Okay. And so the items A to F, are they mandatory considerations or suggested considerations? I guess it's the word may include rather than shall include. Okay. Does may include mean these are suggested topics or mandatory topics?
What do you think? well, it may be that they will be included, but we need to look at, what did you say to me that time? Best international evidence, yeah.
So are they mandatory or advisory?
The mandatory advisory. Go on, you can answer, yeah. You can answer.
I'm afraid, Minister, it has to come through you.
Oh, does it?
Yeah,
Sorry.
yeah. Sorry.
No, that's all right.
Yeah.
I'm being guided by the two
Yes.
people on my right and left, so you have to bear with me. Okay. So it should be it will be mandatory from the Minister, and it will say they should. Ministers may specify, but if the Minister does not specify them, the HSE is to do it. Yeah. So if the Minister gives the instructions, it will happen. Yeah.
Okay, but is it mandatory that the Minister includes these things? Is it mandatory that A2F are included in the health needs assessment?
Yeah. I can't answer that.
It just seems advisory. It doesn't say shall, it says may, and I'm just wondering if it's advisory, what's the point? Maybe it's not advisory, but it reads to me that it's
Okay.
advisory.
Just hang on a second. Okay. Well. Okay. Okay, it's to give parameters for the Minister, so therefore I believe that it is the Minister that will make those decisions. Yeah.
Yeah, no, that's fair enough. I guess I just don't understand. So a direction is given under 10.2c. That's the health needs assessment.
Yeah.
So the Minister directs a health needs need assessment
Yeah.
to be conducted.
Yeah.
And the next subsection says, without prejudice to that, the specific requirements in that subsection may include the following things. Is that kind of a list for the Minister to consider? It doesn't seem that there's any obligation on either the Minister to include them in his or her directive, or indeed for the HSE to do them.
So we'll try and answer this, Deputy Donnelly. It's up to the Minister to define the list of the criteria, and it is mandatory for the HSE. Sorry.
So the Minister defines the criteria.
Okay.
And then instructs the HSE.
Okay. The Minister will define the criteria and instruct the HSE to carry out the the decisions.
Yeah, fair enough, but I still, and maybe I'm just not understanding this, but I don't know whether or not the list here is this just an advisory list? Yeah? And if it's not, should may actually be shall, I guess, is the next question.
Okay.
Today here it's advisory.
Okay.
The list that goes out to the HSE when it's sent out is mandatory.
Okay. Oh, so for today it is advisory, but when the list goes out to the HSE, it will be mandatory.
Okay. It seems a little redundant then, to me. If it's just an advisory list, if I understand you correctly, Minister, what it says is the Minister will issue a directive to the HSE on an annual basis to conduct a health needs assessment, which sounds very sensible. And in issuing that directive, here are some things the Minister might decide to include or not include in that directive. If that's a correct understanding, then subsection 2 seems redundant. I mean, it goes without saying that the Minister can include whatever they want.
Yeah.
Or if it's not meant to be advisory, should maybe changed to shall. I wouldn't support the change, but Otherwise, I don't really understand the point of the subsection. Because you could add a lot of, there's things I'd add in here. I'd add issues around gender, for example. You know,
They can be added.
Okay.
equality of access
Yeah.
That list needs to be looked at.
Okay.
and so forth.
We'll just write that down with you from there. Here, there you go. Okay. I've been advised that today, for today, the list can be changed and other criteria can be added in the meantime.
Okay.
Into
Look, we
future.
won't fall out over it. It just seems a little redundant to me. It's
Okay.
almost, by the way, here's some things you might consider.
Okay.
It doesn't seem to me that primary legislation is the place for that, but that's fine. Could I ask on the same thing? I think the idea of an annual health needs assessment is very welcome, but it's something the HSE doesn't do at the moment, and therefore it's going to require very significant new capabilities to do it. They're going to need healthcare econometricians. They're going to need a load of new data that either doesn't exist or isn't collected very well or is non-comparable around the regions at the moment. Are you satisfied that when this is passed, that the HSE will actually be able to comply with it, that they have the resources, they have the personnel, they have the training, and when in a calendar year would they be expected to start crunching the numbers on these?
No, have you got a date on that? Fine.
Continuous process.
Okay, that's grand. Okay, process is underway to address this, and it will be a continuous process as we journey through the Essential Care Plan.
That doesn't fill me with confidence.
Well,
I mean, have they identified like how many people they need to hire, what kind of skill sets they need to hire? Like if we pass this into law,
Yeah,
the
okay.
HSE has to do it,
yeah, that's good.
right? And this is not a simple desktop exercise. This is for any healthcare system to begin doing this for the first time is really complex to do it right. So could you let us know, have any staff been hired so far?
Yeah.
The total complement, is a new team being set up? What resources they're going to have? Has it been budgeted for? Is it in the healthcare budget for this year?
Hold on.
Public health doctors are the ones who do this, and
All
they
right.
lead this, and the process is underway in the HSE and in the department to ensure that they'll be able to do this.
Okay. Okay, well, I don't have any numbers on figures, but anyway, public health doctors will be the lead, and a process is underway to ensure that this is done into the future. So that's as much as I have on that
That's all we have?
at the moment, yeah.
Okay, let me ask a different question then. Let's assume it doesn't happen this year properly, because certainly that answer, and I know you're just reading out what you're given, Minister, but that answer wouldn't fill anyone with confidence that this is actually going to be in place this year, right? So can I ask, if the HSE isn't sufficiently resourced to do it this year, which it doesn't sound like they will be, and we pass this into law requiring them to do something that they are not equipped to do, what happens if they don't complete it properly? What are the penalties for the HSE of not being legally compliant once we pass this into law?
I'll just take this one.
So it's important to say that they already do this, but they do it in an ad hoc manner, so that resources are not an issue for this. The HSE do this, but it's just we want them to do it in a systematic way,
Okay.
so the people who do it are already there working in the system.
Okay. All right. I'm advised that this already happens in an ad hoc way, and resources are not the issue. Already in the system, there are people who are ready to take part in this. So that's the answer I've been given. So
Okay,
I can
and-
further
and-
develop that for you.
Okay, thank you. And again, I know you're just giving the answers you've been given, but 3 minutes ago, you said it doesn't happen. You're now saying it does happen.
Did I say that?
Yeah. I don't believe that the resources will necessarily be in place. So the question is, if they fail to comply with this, because it doesn't sound to me like the requisite kit is being put in place, but let's assume they fail. Are there any penalties? Are there any implications for the board, for the chief executive, for anyone within the HSE if they fail to comply with being able to present this report properly?
Okay. Well, okay. Well, I suppose I'll just read what I've been given. Penalties have not been identified, are not identified at present.
Okay. Okay. Thank you.
Sorry, Deputy Murphy? Yeah.
Yeah, I just have a few comments at the very end. I suppose there's nothing specific to these amendments.
Okay. So, any other comments on Amendment 2? And, well, 2 and 4 are related. So, the question... Yeah. Are we happy that we've discussed 2 and 4? Yeah, okay. So the question is that Amendment 2 be made. Is that agreed?
Agreed.
Thank you. Amendment 3, again, in the name of the Minister. Minister to move.
I move.
Thank you.
Thanks. Okay. As I outlined when discussing the health need assessment, Section 10 of the Health Act 2004 provides for ministerial direction to the HSE. Amendment number 3 amends Section 6 of Section 10. That subsection requires the Minister for Health to lay copies of directions issued under subsection 1 of Section 10 before both houses of the Oireachtas. The Minister may amend or revoke a decision, a direction issued under Section 10. Amendment 3 is intended to clarify that any revocation or amendment to a direction under Section 1 should also be laid before the House.
Thank you, Minister. Any comments on Amendment number 3? No. The question then is, how stands this amendment? The amendment agreed? Okay. So then, in relation to Section 5, as amended, and as we also the insertion of a new section in that in Section 5, how stands Section 5? Does that should stand part of the bill? Is that agreed? Thank you. We now move to Section 6. Section 6, there is one amendment. It's Amendment 4. It has already been discussed with Amendment 2. How stands Amendment 4? And the question is that the new section be inserted. Is that agreed?
Agreed.
The question is then that Section 6 stand part of the bill. Is that agreed?
Agreed.
We then move to Section 7. Section 7 has a number of amendments. The first amendment is Amendment 5 in the name of Deputy Donnelly. Deputy Donnelly to move.
I move.
And 5 and 6 are related and may be discussed together by agreement.
Agreed.
Agreed?
Yeah. We may be disagreeing with each other later on today, Chair, but we're in agreement this morning. It will start well. So, Minister, I'm very concerned that the board will not have the requisite representation on it. So, one of the things I took on the health brief about this time last year, and one of the things that really shocked me when I looked at the executive team of the HSE and the executive team as it had been for the previous few years, it was only recently that a clinical lead had been added to the senior team, which is absolutely extraordinary for a healthcare system. Just as worryingly, there was no patient advocate at all, at a senior or junior level, anywhere to be found. And I think if there's anything we've learnt over things that have been going on in healthcare over the last while here, we have to have very strong patient representation and patient advocacy at the highest levels and throughout the organisation. And we also have to have senior clinical representation. I think it's one of the big failings of our healthcare system is that there aren't enough clinical leads and clinicians' voice for doctors, nurses, midwives, allied health professionals across the board. They're rendered largely silent. It's interesting when we have health committee meetings and we might have 8 or 9 people in front of us from the HSE. You know, one of them maybe is a doctor, and we hear almost nothing at a senior level. Senior management representing nurses and midwifery, allied health professionals, and so forth. And I think that error is being replicated in this bill that puts the board back in place. And so Amendment 5, I think, is a very important amendment. And what it does is it would mandate that one of the board members is a patient advocate. And that doesn't mean that as well as other things they do in their job, they happen to do some patient advocacy on the side. It's that they are a patient advocate. They are the voice of the patient on the board. I would like to see 2 clinical experts on the board. I looked at the idea maybe of saying one from, you know, one being on the specialist register as a consultant and maybe another representing nurses and midwifery. I think that's probably too specific for the legislation, but the reason I've put in 2 clinical experts is that the clinical community would be represented, not just doctors. I think doctors do need to be represented, but I think there's a very useful opportunity here, for example, to bring on someone representing nurses and midwives onto the board as well. And the final type of board position that I would like inserted into the legislation is financial expertise, for all of the obvious reasons why we need serious financial oversight. I looked at the Minister's appointments to the board. I'm not going to get into comments on any individuals. But I think it's pretty mixed. Certainly there's a few people who've been nominated on there. I took a look at all of their backgrounds and expertise, and I think some of them have relevant expertise to being on the board of the HSE. I think some of them, quite frankly, don't at all, and I have no idea what they're doing there. I don't think it's a well-balanced board. I don't think it has the requisite financial expertise. I don't think it has the requisite clinical representation, be it doctors, nurses, midwives. And I don't believe it has the requisite patient advocacy. I think one of the board members, as part of a long list of things that they do, patient advocacy is one of the things, but they are not there as representing the patient's voice. It's just one thing in a list of descriptors. And so I think we need to mandate this. I don't think we can leave it to government, because we kind of have left it to government, and we've seen the board that has been put in place. And I'm sure they're all very fine people, and I'm sure they would do their very best on behalf of the HSE. But it's not a balanced board at all. And some of the appointments, you really would have to wonder what was driving the appointments, other than politics, I have to say. Some extraordinary nominees. And so I think this is important. I think we have to mandate clinical representation, financial expertise, and critically, patient advocacy on the board. And so I would be very much obliged if you accept the amendment.
Minister.
Thanks, Chair. Okay. The bill provides for 10-person board and chairperson, a deputy chair and 8 ordinary members. Amendment 5 would require that 8 ordinary members is included in patient advocacy and financial experts and 2 clinical experts. I understand that the deputy thinking of this amendment, but the view of the Minister is that best approach is to set out the bill as things stand. Members appointed by the Minister to the HSE board must be people who, in the Minister's opinion, have sufficient experience and expertise relating to the matter connected with the HSE functions to enable them to make a substantial contribution to the effective and efficient performance of those functions. The bill provides for the patient's advocacy experience or expertise on the board This meets the recommendations by Dr. Gabriel Scally in his scoping review. In line with 2014 guidelines on appointment to state boards, vacancies on the board are advertised through the Public Appointments Service (PAS). The particular requirements required for members of the board are set out in the PAS campaign. The recent campaign for members on the board sought candidates with experience and expertise in a number of areas, including corporate governance, clinical governance, quality assurance and patient safety, strategic planning and change management, business management skills, financial planning and management, patients advocacy, strategic human resources management and public communications. As the role of the Chair of the State Board is to identify the needs of the Board for skills, competency of experience in order to ensure that it can be effectively performed its role. It is desirable that the Board members have a mix of competencies rather than specific competencies. The amendment proposed is therefore, in the Minister's mind, not required, and there is a process to ensure that the required skills are competencies for the Board of the HSE.
Thank you, Minister. The problem with that response is that it's not matched in reality. So the board does not have the correct skill mix right now, and there are members who've been appointed to that board who have no experience in healthcare, zero. And what they're doing on that board is beyond me. There is no mandated position for a patient advocate. There is one member who has patient advocacy listed as one of the things they do. There's a bunch of scientists. One scientist is fine, maybe two scientists is fine, but there isn't the clinical expertise. Can I ask you, Minister, for example, is there any appointment to the board? So the board's already been appointed. So we know what happens without this clause because we have a board already appointed. Can I ask you which member or members of the board you think would represent the clinical community? Doctors, consultants, nurses, midwives, allied health professionals.
Thanks, Deputy Donnelly. Well, board members can come from a range of backgrounds, bringing their expertise and their skills. The board is the governing body for the HSE, and we shouldn't be too prescriptive in this legislation. And I don't intend to get into the details of individuals and the board members. And members don't represent groups. They are brought to the board because of their skills. And Senator's amendment and the bill to Senate amendment, the bill to specifically provide for patients' advocacy. So I don't know what it means. Okay, it's just I get it. And there's no requirement on the board just to have one individual who will just represent patients' advocacy. There's other people on the board who have skills around that as well.
The question I asked you, Minister, was who on the board is representing the clinical community across the board? Doctors, nurses, midwives, allied health professionals. Where's that representation?
Well, as you just said yourself, Deputy Donnelly, you've looked at the people who are on the board, you've identified each of them. Some of them, in your opinion, aren't, I don't use the word unqualified, but maybe that's a word we should use, to be on the board. But at the time and now, the Minister has appointed these people, and I'm assured by the Minister and by the Department that these people have adequate skills to deal with all of the things that will be presented to them, to the board into the future. And members don't represent, anyway, again, any particular group. They're individuals with specific skills who've been appointed by the Minister to the board. They don't have just one individual skill.
Do you believe that the clinical community should be represented on the board?
I believe that the members that have been chosen by the Minister to be on the board, who are on the board now, are the people who are well qualified to be part of the board of this new HSE board.
Do you believe that the clinical community should be represented on the board?
I don't have any particular personal opinion on it. I'm just reading to you what already has been stated to me by the Department, that the people on board who have been appointed are well qualified to deal with any situation that can happen.
Do you accept that there's no one on the board representing the clinical community?
I really don't know, because I don't know some of the people on the board myself.
But Minister,
to be
this
honest
is
with you.
committee stage for a piece of legislation for the HSE board. So, with the greatest respect, you should know who's on the.
Well, I
who's
know
on
the
board.
names, but I wouldn't be familiar with all the individuals. And I'm not getting into the details discussing individuals who are on the board.
I can tell you that there's no one on the board representing the clinical community, because ahead of the committee stage, I looked at the board. Now, there's no one representing the clinical community. There's no mandated patient advocacy. You're saying we shouldn't get into specifics, but sure, the whole bill is around specifics. We've just gone through a whole list of
Specifics about individuals, I said.
specifics about board positions.
Individuals,
Yes.
individuals.
No, we're not going to name individuals, but the reality is, we know what happens on the board without mandating clinical representation, patient advocacy, and financial expertise. We know that because it's just happened.
I just want to allow Deputy O'Reilly to come in, if you don't mind, because Amendment 6 is being discussed with Amendment 5.
Yeah,
Deputy
and it's on that. And Minister, can I say, and I do not mean this in any way to be
You're
disrespectful
all right.
to yourself, but I dearly wish that the Minister was here, because it is him who appointed the board, so it is for that reason that we have, and nobody in this room has any concern about a member of the board, but we are concerned about the mix and range of competencies and etc. So I think it's important to say that. I want to move Amendment 6, which would provide for a nomination from the Irish Congress of Trade Unions. The Irish Congress of Trade Unions being a very broad representative group, representing the HSE as the single largest employer in the state. It won't surprise you, Minister, in any way, shape or form that I would propose this, given my background. But it strikes me that, and Deputy Donnelly's amendment and mine taken together, they're not intended to comment on the board, but they're more intended to, I believe, I'm not trying to put words in anyone's mouth now, but certainly from my perspective, what we're trying to do is ensure that the board is the best board that it can be. And with the greatest of respect to the Minister, it is our belief that the more guidance that is put into the legislation to assist the Minister, the better the board is going to be, because the board has an extremely important function, and we see in Sinn Féin, we see a very clear role for a representative of workers in general, but specifically from within the HSE, and we were very clear in ensuring that our amendment provides for that person to have sufficient experience and expertise relating to matters connected with the function of the executive to enable them to make a substantial contribution. So it's not somebody who would just be there warming up a seat. It's somebody who, in the view of the Minister, can, by virtue of their involvement in ICTU, be, and their nomination virtue, actually make a substantial contribution to the board. So we're not seeking to point fingers at anyone who might be on the board, but merely to ensure that the Minister has sufficient guidance, and whoever the future ministers will be, have sufficient guidance in place to ensure that the board is representative. And for that reason, I will support Deputy Donnelly's amendment, but also I believe that the Irish Congress of Trade Unions, as a very broad and representative body, does have and should have a role in ensuring that they are representative, and that workers are represented on the board. The HSE is the single biggest employer in the state. We have seen too often in this state the consequence of ignoring workers when they try to bring issues of concern and bring those to the fore. So, thank you, Chair. Sinead.
Deputy O'Reilly, Minister.
Thanks. Can I just say, just to reiterate about the board members, that they did come through the public appointment service process, just to make that clear to everybody. Okay. And Amendment 6 is concerned with a nominee by the Irish Congress of Trade Unions. The Minister appreciates that the amendment says that the nominee should have sufficient experience and expertise to allow them to make a substantial contribution to the performance of the HSE functions. However, it is established that the HSE board, we need to move away from the corporate or nominations by stakeholders group, however, will suit the role the nominee may be. In the case of the HSE board, his view is that the nominees by individual and organisations would not be good practice and would lead to calls for other bodies to be nominated. I don't intend to accept either of the amendments. Thanks.
Deputy Durkan.
Thank you, Mr. Chairman. As you know, this is a fundamental part of the restructuring of the health services. And I have been on record for a long time about the composition of the board. This is not criticism of the Minister or any of the membership of the board or of my colleagues either. But I strongly believe that the composition of a board, in order for it to work, should be drawn from the country at large, and they should have individually a capacity and a direct experience in the delivery of the services at local level. The problem that I see facing the HSE for as long as it's been around is its inability to connect with the troops on the ground and to connect them to the management. And if you talk to individual service providers, they will tell you that. They feel they're isolated. If you talk to GPs, they'll tell you that. If you talk to nurses, they will tell you that. If you talk to consultants. Incidentally, the clinicians as a group, I don't think that they should have all that influence. I think that where they're coming from is what we need to look at, as opposed to who they are and how much influence they exert at board level. I think it could well be a very dangerous thing, because going back to my previous incarnation, there used to be long battles between membership of the health boards and the consultants, for example, at one level or another. And the question was who dominated whom. And there should be no domination. There has to be an agreed push forward in the delivery of the health services. And as long as there is friction and competition between the two demands, there will always be unease, and there will always be controversy, and there will always be gaps in the system, and there will be gaps that cannot be bridged. So I see, for example, it was alleged by clinicians that politicians should be removed completely and entirely from delivery of anything to do with the delivery of the health services. And that was achieved. But it didn't create a better system. As a matter of fact, the reverse is the case. And by the same token, I have long believed that we need a regionalised system and a national board, this board that we're talking about now, drawn from those regions, in 3, 4 regions, whatever the case may be. That has never been tried. Everything else has been tried, but that's never been tried. And again, I want to emphasise that this is not a criticism of what the proposal before us. It is my belief, and it is my belief based on what I've seen over more than a few years of looking at the delivery and attempting to deliver a comprehensive health service that has the confidence of the general public, and also has the confidence of the practitioners within the system, whether they be doctors, consultants, nurses, physiotherapists, pharmacists, whoever it may be. We've gone away from that completely, and we tend to rely on expertise. And the expertise may be there's a need for expertise as well, and provision has to be made for that. But I think we're missing on the crucial point, and that crucial point is the representational value of the individuals on the board, and where they're coming from, whom they represent. Do they represent, and they should be representing, for instance, GPs on such a board. They have to represent their clients, and they should, and they have first-hand experience of it. Otherwise, it's second-hand experience. And we see headlines all the time about diminishing personnel in various areas, rural areas, or whatever the case may be. They're the people who have direct knowledge and experience of delivering to their clients. In the same way that if we are now, I hope, my belief is that within 5 or 7 years, there will be a change. It will need to go back to that system once again, because I don't believe the system we have now will work, and the revised system, I don't think it will work either. But that's my view, and it's not criticism of anybody, Mr. Chairman. But I think that we need a wholly committed health service, and that commitment requires the inclusion of those who are delivering the services on the ground at board level in one shape, form or another.
Thank you. Minister, do you want to respond to that, or can I bring in Deputy Murphy?
Yeah.
Yeah, Deputy Murphy.
Thank you, Minister. Thank you, Chair. Minister, can I ask you to reconsider accepting these motions, please, or amendments, rather? Minister, surely board members should be made up of the best qualified people for that particular board, and not who they are or what background they came from. And I think it's very important that there's an appropriate level of expertise on any board, and obviously we're just talking about a specific board here, but I would ask you to reconsider, please, Minister.
And Minister, could I ask, I understand that the board members are there in their personal capacity. I presume they're in their personal capacity, that they're not a representative of a particular group, that people are not appointed to the board to represent a particular group.
Yeah.
So I suppose to parse what Deputy Donnelly is saying, he's suggesting, I think, that the board members should have a clinical background, a financial background, and an advocacy background, but not necessarily representing any particular group, but have the expertise in those fields. Perhaps you might make a comment on that.
Yep. Thanks again. Thanks to all of the members of the committee as well. I just have to refer back to one of the documents that have been given to the Minister's office, and to just again point out that the potential board applicants appointees came through the Public Appointment Service Board, and the state process advertising and competency software board appointments allows candidates to put forward from appointment basis on their skill and their expertise that they bring to the board. And again, just to reiterate that the Minister does not intend to accept these amendments. And just again to go back to the board members, though I don't know any of them, I know one of them individually, just that's myself on a person. I don't know on a personal basis, but I know him through a group he worked through Bernardo's. I'm not sure to be able to comment on whether or not that we can accept the fact that these people were all appointed because of their expertise and their individual expertise as well. And even though that they don't represent one particular group, they have other expertise in other fields as well. So I'm not in a position to accept amendments from either of the deputies.
Are there any other comments on these amendments?
Yeah, look, we've made the argument, and Minister, I know you've been asked to step in at the last minute, and maybe you didn't, know you were coming in today. So this is, I mean, this is no reflection on you. You've been asked to come in by the Cabinet Minister. But I do think, Chair, in a discussion on legislation to reinstate the board at HSE, and again, I mean, this is no reflection on the Minister who's here, I do think it's pretty extraordinary that Minister Harris would not turn up. Like, this is an important conversation. The Minister doesn't have the briefing, and even if she did have the briefing, wouldn't be in a position where she could make any decisions on it, because she's not the line Minister, she's not the Cabinet Minister. I think it's extraordinary that Minister Harris is not here to debate the issues about the reinstatement of the HSE board. Like Deputy O'Reilly and I and Deputy Durkan and Deputy Manny, we're talking about whether or not anyone on the board of the HSE should have a medical background. That's a pretty important conversation to have. Now, I've looked at the board, and I'm open to being wrong on this, but my understanding is not one member of the board has a medical background. Now, if that's correct, that is a pretty extraordinary situation. And I think Minister Harris should be here to explain to us why, in his opinion, he's comfortable that no one on the new board at a HSE has a medical background. That is pretty astonishing stuff, right? So we've rehearsed all of the arguments. I will be pressing this amendment because I've heard nothing that gives me any confidence that without these amendments that the HSE will have the requisite experience it needs. How any government could try and tell Parliament that the board of their health system has the correct blend of skills and experience when not one member of that board has a medical background is absolutely extraordinary. and yet that is what we're hearing today. So I'll leave it at that, and I will be pressing the amendment.
Thank you, Deputy Donnelly. Deputy Durkan?
Yeah, well, there's a slight difference between what my colleague is saying and what I'm saying, Mr. Chairman, as you would have detected. As you know, as the guy said when we were looking for directions, if I was going there, I wouldn't start from here. And by that same token, I'm just a little bit worried about one of the things that Deputy Donnelly said there. You know, one member of the board could have a medical background, but it could be tilted in the direction of one particular profession, which might not necessarily be of any great advantage to the board at all. So and it could tilt it away and skew the authority of the board in a particular direction. So I would be worried about that. I don't think it would be truly representative, and I don't think it would be a good thing. And I think that you might be just as well off to have people who don't have a particular bias. But my own view strongly is, as I've already said, we should have representation on the board representing the people who are delivering the services on the ground, or directly. And that wouldn't necessarily enlarge the board to any great extent. But I have spoken about this during the Sláinte Care hearings, and I've spoken about it many, many times. Nobody agrees with me. You'll be glad to know, Mr. Chairman. That's not for the first time in my life, by the way. But I do want to say, I do want to emphasise this. I believe that my view is based on long experience of listening to various boards associated with the health services over the years. I don't think we can ever come to a seamless delivery of health services unless we have that kind of mixed representation from the people on the ground, from the nurses, from the GPs, from the consultants, from the pharmacists, all of the people who are involved in delivering the health services. It does two things, and this is a matter of for some time now or in the future. It does two things. It creates an equilibrium within the deliverers of the service that you cannot get otherwise. Otherwise, you have a de minimis situation where people resent what they're being asked to do on the basis that the people who are asking them don't have the necessary experience, and it very often happens that way. So I would emphasise again that my views are not the same as my colleagues, Deputy Donnelly's, but I hear what he's saying. The important thing is that if we were delivering a service to some executive, that would be a different story. We're not. We're delivering a service to the people, and the people's practitioners on the ground need to have some access to that board, be represented on that board, or have a representative on the ground from the board, in order to keep the dialogue going in both directions. However, I've said it all before, I don't expect anybody to agree with me, and I'm not going to cry all the way home if nobody agrees with me, in fact.
Well, my memory of the Sláinte Care committee was that it was a definite decision that the board should be reinstated, but it was also a definite requirement that those members on the board would have specific expertise in relation to delivering a health service. And I think that was the intention of Sláinte Care. So, Deputy O'Reilly.
Yes, Chair, very briefly, the fact that Minister Harris is not here, it doesn't matter. See, we can make all of the persuasive arguments in the world, and we could persuade the Minister who's here, but she's not in a position to accept our amendments. The Minister himself is. And it does now, and it's important, and that we put on the public record our views, and that we push our amendments, and that process takes place. But to a certain extent, it doesn't matter how persuasive our arguments are, because if they're not going to be accepted, they're not going to be accepted. And what's going to happen then is that these are going to be pushed. Any amendments that are pushed are going to be retabled again, or withdrawn and retabled, and we'll have this discussion again. And it is an important discussion to have, but it does seem somewhat, and I don't mean this disrespectfully, and please don't take it as such, but it does seem somewhat futile that we could make a very persuasive argument, and indeed I believe we have, but of course I would say that, but we could make a very persuasive argument, and in the end our amendments are not going to be accepted, and that is just a small bit frustrating.
Thank you, Deputy Donnelly. Minister, have you any
O'Reilly.
further comments?
No, just to say that I will bring the concerns of the deputies who've raised them back to the Minister, but at present, at committee stage now, I won't be accepting amendments on behalf of the Minister.
Thank you. So the question then is in relation to Amendment 5 under the name of Deputy Donnelly, that this amendment be made.
Yes.
Agreed. You're pushing that amendment?
Yeah.
So, on Amendment 5, the question is that the amendment be made. Those in favour say Tá.
Tá.
Tá. Those against say Neil.
Neil.
I believe the question is carried.
Just to be clear, carried means it's
Sorry, accepted.
Okay. Are we out now? Okay. Can I just read this? Yeah, okay.
Are you calling a vote?
Won't make any difference. We can have a vote on, but it won't make any difference. Chairman.
Well, on the voice vote, the amendment has been carried.
Yeah, well, I don't accept the amendment on behalf of the Minister. Okay.
Well, then you need to call a vote.
Call a vote? Yeah, vote off. Yeah.
Vote off. 8 minutes.
Well, 4 minutes.
Well, unless everybody turns up. So the clerk will go through the procedure.
Okay. Minister Byrne,
O'Neill.
Deputy Donnelly,
Tá.
Deputy Durkan,
Neil.
Deputy Harty,
Tá.
Deputy Alan Kelly, Deputy Murphy O'Mahony,
Tá.
and Deputy Louise O'Reilly.
Tá.
Okay.
So the result of the vote is Tá 4, Neil 2. So the amendment is carried. We now proceed. Yes, sorry, Minister, you can.
Vote on the results of the vote, just to announce to the members and to yourself that this has implications for the bill and will result in report stage amendments. Minister will have to consider what amendments will be needed and will have to take legal advice on them.
Thank you. We now proceed to amendment number 6 in the name of Deputy O'Reilly. Deputy O'Reilly to move.
I move.
And the question is that the amendment be made.
Press it.
Those in favour
That the amendment be made. Is that agreed?
that the amendment be made, is that agreed?
Agreed.
So,
Did you ask me? Miss out on that. You are asked.
So in relation to
Sorry.
amendment number 6, the question is that the amendment be made. All those in favour say Tá.
Tá.
All those against say Neil.
Neil.
I believe the amendment is lost.
Vote all.
As full membership of the committee is not present under standing orders, we are now obliged to wait 8 minutes or until full membership is present before proceeding to take this division.
Minister Catherine Byrne.
Neil.
Deputy Stephen Donnelly.
Neil.
Deputy Bernard Durkan.
Neil.
Deputy Michael Harty.
Neil.
Alan Kelly. Absent. Margaret Murphy O'Mahony.
Neil.
Louise O'Reilly.
Tá.
Thank you. So the result of the vote is Tó 1, Neil 5. The amendment is lost. We now proceed to amendment number 7 in the name of Louise O'Reilly. Deputy O'Reilly to move.
I move. The purpose of this amendment is just to ensure that the Health Committee has, and other committees have a role in interacting with and scrutinising members of the board. And I think we could debate all day how every single one of us wants the right people to end up on the right board, and I think we're all at one on that, albeit we may have different views about how the right person ends up on the board. Recently we saw the appointment and reappointment of the National Paediatric Hospital Development Board. Now look, we've all had plenty of discussions around that and around what does and doesn't constitute a competency-based board. When an issue arises with the board and when an issue arises with the HSE, we tend to have to raise that with the Minister. But I think there is a role for the Oireachtas in hearing from persons who are proposed by the Minister, so that TDs can discuss the approach that they will take in their role, so that we can understand how it is they're going to approach their role on the board, and that we would have some involvement in that engagement. I think, and of course I would say this, wouldn't I? But I think this is a sensible proposal, and in the interests of transparency, I do hope that the Minister, notwithstanding what was previously said, I do hope the Minister is in a position to accept this amendment, and if not to accept it, to recommend that the Minister give it consideration.
Thank you, Deputy O'Reilly. Minister.
Thanks, Chair. The Code of Practice for Governance of State Bodies 2016 and the Guidelines on Appointments of State Board Members 2014 note that a person being proposed by Minister for appointment as Chair of State Bodies are required to make themselves available to the appropriate Oireachtas select committees to discuss the approach which will be taken in their role as chairperson and their views about the future contribution of the state bodies of boards in question. There is no requirement to the Code of Practice for other members to appear. The amendment proposes places the requirement in legislation on the chairperson and on the other members of the board, the deputy chair and the ordinary members. The Minister's view is that part of the role of the chair to lead the board and would not be advisable to have all members with the same function. In addition, the Minister does not believe that the provisions of this kind need to be provided for in the bill. The system for proposed chairpersons to come before committee works well in practice, and these provisions are normally not in legislation. The Minister does not therefore propose to accept the amendment.
Deputy O'Reilly.
Well, that's very unfortunate, because I actually think it's an opportunity for us to, as a committee, and for the other committees to have some engagement with all of the members of the board. And I actually think that recent events have proven that engagement could have some value. But Sinead, and I mean, we've already discussed the fact that you're not in a position to accept any amendments, so I literally could make the most persuasive argument of my life, and it's not going to be accepted by the Minister. I'm not suggesting I was about to do that, by the way, but I might have been, but it wouldn't have made any difference, because it's not going to be accepted by the Minister. And again, look, I don't mean this disrespectfully, but it is a pity that the person who could accept those amendments did not see fit to attend this meeting, and I'm sure that the apologies are accepted and all of that, but it is a pity, because I actually believe that the amendments that have been put forward here, they're done so in a very constructive way. They're done to ensure that the bill is improved and that the bill is as good as it can be. But anyway, Sinead.
Any other members wish to contribute to this debate? No. The question is then that the amendment be made. All those in favour? Or is that agreed?
Chair, I will withdraw this amendment, but I will retable it at the next stage.
Thank you. Thank you, Deputy O'Reilly. We now move to amendment number 8 in the name of the Minister. Already discussed with number 1. The question is that the amendment be made. For the Minister to move, sorry.
I move.
The question is that the amendment be made. All those in favour?
Tall.
Agreed? Sorry. Agreed?
Agreed.
Thank you. That amendment number 9, again in the name of the Minister, discussed with number 1. Amendment 1. The question is that the amendment be made. Is that agreed?
Agreed.
Amendment number 10 in the name of the Minister, already discussed with number 1. The question, or the Minister to move, sorry.
I move.
The question is that the amendment be made. Is that agreed? Amendment number 11 in the name of the Minister, already discussed with number 1. Minister to move.
I move.
The question is that the amendment be made. Is that agreed? Amendment number 12, again in the name of the Minister, already discussed with number 1. Minister to move.
I move.
The question is that the amendment be made.
Agreed.
Amendment number 13 in the name of the Minister, already discussed with number 1. Minister to move.
I move.
The question is that the amendment be made.
Agreed.
Amendment number 14, again in the name of the Minister, already discussed with number 1. The question is, the Minister to move.
I move.
The question is that the amendment be made.
Agreed.
Thank you. And amendment number 15, again in the name of the Minister, already discussed with number 1. Amendment number 1, Minister to move.
I move.
The question is that the amendment be made. Okay. The question then is that section 7 as amended stand part of the bill. Is that agreed?
Agreed.
We now move to section 8, amendment number 16 in the name of the Minister. Minister to move.
I move.
Thank you.
Thanks, Chair. The bill currently provides the terms and conditions for CEOs are determined by the Minister with the consent of the Minister of Public Expenditure and Reform. The Board does not have a role. However, given the CEO's appointment by the Board and the Board will be managing the CEO performance, the Minister has given this further consideration and proposes that the Board should determine terms and conditions for the CEO. The Board will need the approval of the Minister, given with consent of the Minister for Public Expenditure and Reform. This is a process made in many other acts.
Thank you, Minister. Any comments, Deputy Donnelly?
Yeah, thanks. I'm just not entirely clear on the wording, right? So basically I want to see if the Minister for Public Expenditure and Reform is still included. So as it would read, if I understand it correctly, then it's subsection 21A, paragraph 3. The CEO shall hold office upon and subject to terms and conditions as may be determined by the Board with the approval of the Minister given with the consent of the Minister for Public Expenditure and Reform.
Yeah.
Is that right?
That's correct, yeah. That's correct, isn't it?
Is this a policy change? Has the government decided that the terms? So it looks like a policy change. So as the bill is passed at second stage, says the CEO shall hold office subject to terms and conditions determined by the Ministers for Health and Public Expenditure and Reform. That's essentially what it says now, and that's being changed to terms and conditions as determined by the Board, as opposed to as the Minister for Health. Can I ask that? That's a policy change. Can I ask what the rationale for that is?
Oh, yeah. Okay, I suppose just on the response here, the Minister would always have a consultation with the board. I think the Minister has given further consideration for the proposed and proposed that the board shall determine terms and conditions of the CEO.
No, I accept that. My question is why.
Well, oh, sorry, why? A second. Apologies. The position would be that the board determines the terms and conditions which approved of the Minister, given the consent of the Minister for Public Expenditure and Reform. In practice, the board would work on appropriate terms and conditions for the CEO, determine the terms and conditions, and put these to the Minister for the Minister's approval. The consent of the Minister for the Public Expenditure and Reform would be needed before approving the terms and conditions. This arrangement is found in other acts, for example, in Child and Family Agency Act 2013.
And would it allow for the board to set, for example, a pay level above public service caps?
I don't know. Sorry, Deputy.
It's all right.
Yeah, okay. Minister of Finance. Yeah. That would need approval from the Minister of Finance and Expenditure.
Okay, but does it allow the Minister for Public Expenditure? So let's say the board decides. So right now, for example, there's been a lot of people have interviewed for the job. And my understanding is there's no one has been accepted for the job, and there are some people saying, look, we need to significantly increase the salary, for example. Would this change the boundary conditions or the constraints? I guess I'm trying to understand what you're doing here is you're saying the Minister no longer sets the terms and conditions, the board does. The question is, does that change anything in reality? Does it give the board more latitude, for example, in terms and conditions that the Minister might have?
Oh, yeah. No, it would need approval from the Minister, our Minister, Minister Harris.
Yeah, no, I accept that, and from the Minister for Public Expenditure and Reform. My question is, does it change the latitude available? So what this amendment does is it says the terms and conditions will not be set by the Minister, they'll be set by the board. In real terms, does that give the board more flexibility or less flexibility, for example, than the Minister would have?
Okay. Okay, the Minister would always have consultation with the board, and the board's best place in the first instance is to work with the terms and conditions which they're provided with. So.
Sorry, that it's provided with?
Yeah.
That who's provided with?
The term and conditions that the board work under, their terms and conditions.
So would it be the board that would set the terms and conditions, which would then be approved by the Minister?
Yeah, that's what I read in the first place, yeah.
Okay.
In the opening statement, yeah. Will I read it again?
No, it's fine. No.
Follow-up question, Minister, which is, does that change the latitude available for the terms and conditions? So, for example, is it the case that the board could turn around and say, do you know what, we need to pay $500,000 a year to this person, whereas maybe a Minister for Health couldn't? Or could, I don't know. That's the question I'm asking is, does it change the freedom available to set different terms and conditions?
Sorry? Okay. Yeah, the board would put proposals to the Minister, and they would have to be approved by the Ministers, both Minister Harris and Minister Donnelly.
I know that. That's not the question I'm asking. The question I'm asking is, does the amendment does the board have more latitude in setting terms and conditions than a Minister would have?
No.
Thank you.
No, I'm sorry, I'm reading back through this. No, sorry.
Thank you. Okay.
Yeah, this is the thing that I'm just curious as to the wording with the phrases like by the board with the approval of the minister given. It's a rather unusual use of the English language. I've never seen it before, and I just wonder, what does it mean? Does it mean the prior approval of the minister? Does it mean the prior approval of two ministers, or minister or ministers? Or does it mean, because you could say given the approval of the minister, but the approval of the minister given, I've never seen that before, so I don't know why it's in that fashion or in parliamentary draftsman's language. I've never seen that before, so maybe I have my education has been neglected to some great extent along the way. But I'd just like to know, does it mean something that we're not aware of? Because it's twice, and I just don't know.
Minister?
Perhaps, or if necessary, if the minister could look at it and maybe come back to the come back at report stage or whatever, and maybe have it clarified. That would be fine. I don't mind.
Could we seek further clarification on that, Minister?
No. No. I don't know. Can we seek further? Yeah, we can.
Is the amendment withdrawn with a view to further consideration?
Yeah.
Sorry.
Yeah, it can be brought at report stage. It can be brought at report stage.
Yet though, report stage is too late for any debate. Like at report stage, it's all done. Could we get a briefing note ahead of time?
Yeah, I'm sure that's possible, yeah.
Yeah.
I think that would be really
Yeah,
Thanks.
that'll be
Yeah, it's
fine.
possible, yeah. Will you write that down?
That on Amendment 16, that the amendment be made? Agreed?
Agreed, sorry.
Thank you. Amendment 17 in the name of Deputy Louise O'Reilly. Deputy O'Reilly to move.
I move. This amendment is very simple. It just seeks to ensure that the Chief Executive Officer should not hold any additional office. So we saw with the previous DG that person had a role in another company. To my mind, the job of running the Health Service Executive is a big job. It should take up all of their time, and we should be absolutely 110% sure that there is no scope for any conflict of interest or any suggestion of a conflict of interest. I think that it's not appropriate for the CEO to have another job or to sit on boards. I think that his or her focus should be solely and entirely on running the Health Service Executive. I don't think that there should be any division in that regard, and that's what the amendment seeks, is just to leave it at the Chief Executive Officer shall not hold any other office or employment or carry on any business. See, it says without the consent of the board, and the board shall inform the minister, but you know, the previous holder of the role had informed the minister that they had an additional role outside of their role within the health service, and I'm not suggesting that there was anything untoward about that. I just don't think it's a good idea. And where that latitude was available, that latitude was given previously, and I just think we need to remove that latitude and ensure that the person who is in charge of the Health Service Executive and in charge of running the Health Service Executive is focused solely and entirely on that job. Sinead?
Thank you, Deputy O'Reilly. Minister?
Thanks, Chair, again. As things stand, the bill, the CEO is prohibited from holding any other office, employment or business unless approved by the board. The Minister must be informed of any other such decision by the board. The proposed amendment would prevent the CEO from holding any other office under any circumstances. This issue arose during debate in the Senate, and as the Minister's view was that it was not possible to foresee all circumstances, and that there may be situations where holder office other offices may be justified. The legislation that currently stands allows for this. While given the safeguard that the board consents it's needed, the board will be the decision maker. If the board believes it is not appropriate, the CEO cannot undertake the work in question. The Minister does not If the board believes that it is not appropriate, the CEO cannot undertake the work in question, and the Minister does not therefore propose to accept this amendment.
Thank you, Minister.
Chair, can I just
Deputy
ask a very brief question? Just what roles or membership of what boards does, and it might be that this is more appropriate for a briefing note, and I'm perfectly willing to accept that, but in what circumstances do you think it would be all right? Because I actually can't think of any. I mean, I appreciate what the Minister said, and I know the debate in the Shannon, and he said that you can't envisage all circumstances and it might arise. I just think that the person who is in charge of the health service should be solely focused on that, and I can't think of any scenario whereby that person, whereby the membership of another board or working for another company would be appropriate, or indeed, and let's be clear on this one, or beneficial in any way, shape or form to the running of the HSE. I just can't see it. And it might be that the Minister had a scenario in his head which I haven't thought of, where it would be of some benefit, or maybe neutral, or no benefit at all but no harm to the role of this person in running the health service executive. But I just cannot see. I mean, it's a huge, big job. It's incredibly time consuming. I don't know where this person would find the time. And I don't know that it is appropriate for that person to be in a situation where they have to find the time to carry on other work or other business. Thank you, Chair.
Deputy O'Reilly.
Thanks, Chair. We would all expect that the CEO of the HSE to be focused on the job that they're asked to do in the HSE. Again, the issue is not possible to predict all situations, and there may be valid reason for the CEO to hold some other office. Rather than excluding possibilities completely, we have to make it clear that the CEO cannot hold any other office without the consent of the board, and for this reason the Minister will not be accepting this amendment.
Minister, could I ask, is this a change? In the previous board, was it the consent from the Minister, and this is now moving the consent to the board?
Yeah, hold on a second. I'm sorry, Chair, for a second. Within, is that? Oh, yeah. Okay. Okay. Sorry, Chair. The Minister has authority within the DG appointments, and this would always be the intent that it would move to the new board.
So it is a change.
Yeah, is it not a change? Oh, okay. Well, currently there's only a Director General and he doesn't have a board.
Okay.
Okay.
Yeah. Thank you. Deputy O'Reilly.
Chair, on the basis of previous remarks I've made, I am going to withdraw this amendment and I will retable it at the next stage.
Thank you, Deputy O'Reilly. So that Amendment 17 is withdrawn. Agreed?
Agreed.
We now move to Amendment 18 in the name of the Minister, already discussed with number 1. Minister to move.
I move.
The question is that that amendment be made. Is that agreed?
Not agreed.
Number 1. Sorry,
Number
not
18.
agreed?
Not agreed.
Fine. Minister?
Sorry.
That's your amendment, number 18.
Yeah, no, I will press my amendment, yeah.
You press the amendment?
Yes.
Okay. So, in relation to Amendment 18, then the question is that this amendment be made. All those in favour say "tá."
So,
All those against say "níl."
Neil?
I believe that the amendment is lost.
Great.
Agreed?
sorry.
Excuse me, carried.
Sorry.
It's your, minister, it's your amendment, Minister. The amendment is carried.
Yeah,
Yeah. Agreed?
agreed, yeah.
Okay. Amendment number 19. Again, in the name of the Minister, already discussed with number 1. Minister, to move.
I move.
The question is that this amendment be agreed.
Agreed.
Is that agreed? Thank you. Amendment number 20, already discussed, in the name of the Minister, already discussed with number 1. The question, Minister, to move.
I move.
The question is that the amendment be made.
Agreed.
Agreed. Amendment number 21, in the name of Deputy O'Reilly. Deputy O'Reilly, to move.
I move.
Thank you.
Chair, this is a similar amendment to the previous one discussed, and it has to do with the avoidance of any double job and conflict of interest, and there's probably nicer words for that now, that fail me at the moment. But I have a difficulty with the person who's the head of the health service having other jobs, other calls in their time, and so that's the purpose of this. It's to ensure that the focus is solely and entirely on the role as the Chief Executive or Director General of the HSE. We saw previously where additional roles were approved by the Minister. That doesn't make it right. It means that it happened. Sinead.
Minister.
Thanks very much, Chair. Sorry. Sorry. I can't hear you, sir. 21. Is there a different issue, is it? Yeah, okay. Yeah, we have removing provision for CEO and not being required to give an account to the committee of any other matter and has been made at further time, be the subject to court or tribunal proceedings. Is that?
Notes I have. Chair, in the interest of getting this done, I will withdraw that amendment and I will reserve the right to retable it as required.
Sorry, Deputy Donnelly, did you wish to speak?
Well, if I'm understanding the amendment correctly, actually, I think it's a very sensible amendment, Chair. If I understand, the paragraph is in relation to the Chief Executive coming before the Oireachtas, so mainly to this committee, I would imagine, and probably to public accounts. And there's a get-out clause, which says the Chief Executive Officer shall not be required to give an account before a committee of any matter relating to the general administration of the Executive, which is, or has been, or may at a future time be the subject of proceedings before a court or a tribunal in the state. That pretty much gives carte blanche for the Chief Executive Officer to just never appear, right? That I think Deputy O'Reilly's amendment is spot on. It doesn't try and delete the paragraph, but I mean, you can't have a situation where the head of the health service says, "I'm not coming in because at some point in the future somebody may take a case over," I would imagine, almost everything this committee has discussed in the last year. There could be legal cases in the future. So I have to say, I think it's a very good amendment, and I would be inclined to support it. Maybe the Minister has a solid legal reason why it has to be in there, but in the absence of a solid argument from the Minister, I don't see why you would give that sort of carte blanche to any executive officer.
the deputy has withdrawn the
I will be retabling it.
at a future
and the
date.
support is welcome, yeah, absolutely.
Okay, so of course you're entitled to comment on it. Yeah.
Probably should have spoken sooner.
Yeah.
Apologies. But if possible, and maybe we've moved on procedurally, but the Minister hasn't answered the question. The Minister is...
Well, it's withdrawn,
It's
so
withdrawn,
unfortunately...
so I can't answer it. And Deputy O'Reilly said she will bring it forward again, so I can't answer it. She's the deputy who
It's a
tabled.
sensible amendment. I'll bring it forward.
Yeah.
And as I said, but Minister, I'm going to say this again. It does not matter because you are not in a position to accept any of our amendments and that you will be opposing them. And I really want to emphasise to you how absolutely frustrating that is for us, because it's... it doesn't seem like the purpose of this is to scrutinise legislation and to hear the views of the opposition, but regardless of those views, they won't make any...
And I just, Chair, for what it's worth, I want to add to that. Like, I know it's Deputy O'Reilly's amendment. It's a good amendment. And the Minister didn't answer the question. She read out a single sentence. And this is becoming farcical, quite frankly. Like, if the Minister can't engage in the substance of the amendments, the Minister shouldn't be here.
Unfortunately, we have to move on.
I know, but it's ridiculous. Like a single sentence in response. Like, either the government is able to engage in the materiality of amendments at committee stage, or they're not. And if they're not, they shouldn't be here.
Chair, can I just point
Yes,
out
Minister.
to Deputy Donnelly that I would have engaged in it if Deputy O'Reilly hadn't withdrawn it, but she's withdrawn it, so it's really taken. I cannot comment once the Deputy who's proposed the amendment has withdrawn it. So I'm sorry for Deputy Donnelly if he doesn't consider that my presence here isn't relevant. My presence is very relevant here. I'm here on behalf of the Minister, Minister Harris, and I'm here on his behalf. And the amendments in front of me, as I've been given the text, the Minister has not accepted, and I can't counteract that. Sorry.
Thank you. So I'm now going to move then that Section 8, as amended, stand part of the bill.
I'd like to speak to the bill, please. Sorry, to the section.
Speak to the section.
Yeah,
Yes.
thank you. Minister, page 15 of the bill, 21E, paragraph 2, states the Chief Executive Officer shall not be required to give an account before a committee of any matter relating to the general administration of the Executive, which is, or has been, or may at a future time be the subject of proceedings before a court or tribunal in the state. Can I ask why the government feels the need to provide such blanket coverage, including hypothetical future court cases? I have a few questions, but we might take them one at a time.
Okay, sorry, just put it over here. My apologies. Okay. When this issue was raised in the Senate, and the Minister made the point that it is essential that not only in the integrity of any current court proceedings protected, but also the integrity of future court proceedings is protected. So that might clarify that.
It doesn't clarify anything. What does that mean?
Sorry?
I don't understand what that means, Minister. What does that mean?
Well, can I read it out again?
No, I heard it. I don't understand what it means. Could you provide the committee with an explanation of why the head of the HSE would not need to come before a committee and can use an excuse of a subject potentially in the future being the subject of a court case, which most things in the HSE are?
Can I just answer that? Okay. The reply to the Deputy's question is the Minister doesn't want to jeopardise any future court cases that may occur.
How would future court cases be jeopardised?
Sorry. No, hang on, just get that page there for a second. Let me see that page for a second. Sorry a second. I've just picked up the wrong piece of paper. Like that. Okay. Okay, can I just I'm in here? Okay.
Thank you.
Firstly, the CEO must inform the committee if the options this provision applies to in a matter in which there has been asked to give an account and must be given the reasons for such an opinion. There must be given in person or in writing to the committee. And secondly, either side of the CEO or chairpersons of the committee may within 42 days apply to the High Court for determinations on the matter. This is the right procedure in the correct process, which safeguards to ensure there's transparency and accountability. These provisions are standard and I think are reasonable, and I hope that the Deputy will understand what I've just read out. Thanks.
Minister, what you've read out is paragraphs 3 and 4, but we're talking about paragraph 2. And the question stands, this paragraph gives the Chief Executive Officer of the health system the ability to not appear before any Oireachtas committee on any issue which may at some future state hypothetically be before the courts. That rules out pretty much everything in the healthcare system. Why? I can understand the committee not bringing in a chief executive for a matter which is before the courts. I think it's Standing Order 50 or one of those. And that's very specific, Chair. That is only about matters which are before the courts with a jury, where the jury might be influenced by conversation in the Oireachtas. It's not that the Oireachtas can't discuss matters before the courts. We can, and we do it all the time. Cervical check is before the courts. We still discuss it here. This is an extraordinary level of protection for the Chief Executive, because any matter that this Health Committee or the Public Accounts Committee might decide can be deemed as potentially before the courts in the future. So I still don't have an answer as to why such an extraordinary level of protection is being granted. The Minister has stated that it's to protect future court cases. I don't understand how us discussing things here in some way jeopardises future court cases. If you were to apply that, sure, you couldn't. You'd shut Parliament down. So maybe the Minister might be able to expand on that.
Well, I've just been advised that the CEO has to explain his or her reasons to the committee, and the committee can bring these. They can bring this further if they want to, and some of these provisions are already stated in legislations.
Thank you, Minister. Yeah, that's paragraphs 3 and 4, which lays out the procedural issues. The question I'm asking is on paragraph 2, which is why the government is choosing to give such extraordinary protection from parliamentary accountability to the Chief Executive Officer of the HSE. And in what way? The reason you've given is that it would in some way jeopardise future court cases. Can you explain how this committee discussing issues with the Chief Exec would jeopardise future court cases?
Oh, yes. And similar. Okay, right, okay. Again, on advice, in paragraph 2, it is to protect court cases similar in paragraph. Oh, sorry, I can't. Similar. I can't. My apologies. Okay, all right. And similar paragraphs are in other legislation.
Look, I'll leave it at this. I don't think you have an answer. The question I'm asking, and I think I'm asking it again, it's a very direct question. Extraordinary protection against parliamentary accountability is being afforded in this paragraph to chief executives of the HSE. The rationale you have given is that that is being afforded to them in order to not jeopardise potential future court cases. I don't understand how discussion in this committee jeopardises future court cases, and I'm worried because if we accept that logic, then are we allowed to discuss anything in committee? And I know I'm pressing the same question. I'll leave it at that, Chair, but I don't.
You have to move on. Deputy O'Reilly to finish.
Chair, just on that, what the Minister is seeking to do is to assume the powers of massive foresight, and the committee doesn't have that, and effectively we will be neutered, we will be precluded. But and similar to Deputy Donnelly, I just can't understand how in practice that would work, because all that the Chief Executive or the DG or whatever terminology has to do is simply, when we write to him or her and say we want to see you to discuss this matter, all they have to do is write back and say this matter could potentially be the subject of a court case. And sure, of course it could. Anything could. So the view, I think, shared by some of the people here is that this will effectively give the person in charge a veto. Now, I have withdrawn my amendment on the basis that I will be retabling it, I can tell you that now. But in the intervening time, it might be helpful if we got a note. So like, we're clearly saying you're giving the DG a veto on ever coming in front of a committee, and you're saying that you're not, okay? So perhaps you might, and we've outlined the reasons why, and very valid reasons, by the way, why this is effectively a veto for this individual, but you believe that it isn't. So perhaps you could get the Minister to outline for us in some detail as to why he believes it won't operate as a veto. And not unlike yourself, Minister, when you come in and say, I won't accept any amendments, I will do my very best to accept the explanation given by the Minister, but don't be surprised if it doesn't satisfy us. So before we get, and well in advance of getting to report stage, perhaps we could have that note and an explanation as to how you believe it won't act as a veto, because to my mind it clearly will.
Thanks, Deputy. Chair, sorry. No,
Deputy O'Connell, yeah.
Genuine concerns being raised here about the effect of this piece in paragraph 2. So I think, and just to support Deputy Louise O'Reilly, I think it would be very helpful if we got a note. We don't end up in a situation where we can't. In the last couple of years, the amount of times we've had the top of the HSE in and the amount of information we've got. So there seems to be a difference in what this is saying. So I think it would be very helpful for the committee. It seems to be all seem to have the same concerns here.
Thank you, Deputy O'Connell. Minister, to finish.
Yeah, sorry, Chair, I will relay the concerns back to the Minister. I'm going to ask about the report first.
Thank you. So the question then is that section...
Just other bits, if I could, on this. These are less contentious, Minister. And look, I know you're trying to do your job, but like just on the other one, so the National Children's Hospital could easily become, subject of a future court case. Cervical check is... Spinraza, the drugs, orphan, like everything we do here is or could be the subject of a court case. So anyway, Minister, on two less contentious ones, if I could just get some clarification. The first one is on page 13, 21B, 4B, right? And what it says is the Chief Executive Officer...
Amendment...
No, speaking to the section, Chair, section 8.
Okay.
The Chief Executive Officer shall cease to be qualified for office if he or she and B is convicted of any indictable offence. This is just a question of clarification. Are there very minor things like speeding offences or others that one could arguably pick up, but which may not mean that you should be fired? Would you be able to just provide a bit of clarity, and this is for my own clarification, on what is an indictable offence? Is that a much more serious kind of criminal offence, or could something relatively unrelated to the role of being a good Chief Executive Officer be an offence, be an indictable offence?
Okay. Just on listening to the Deputy's question, I would imagine it would be a more serious offence, but I am prepared to come back and clarify that for you, or ask Minister Harris to clarify that for you.
Thank you. Yeah, it'd be an awful shame, let's say, if you had a really good Chief Executive and they didn't spot the 60km/h sign and ended up having to be fired over it. Not condoning speeding, obviously, but if we could just, yeah. I don't know. We'll look it up. But if you could get us a note on what's included in indictable offences, because Because
It's up there.
paragraph 4 says shall cease to be qualified for office. This is black and white.
Sorry?
The point, Minister, is that the legislation says that the CEO shall cease to be qualified.
Yeah.
So it's not that it can be raised by the board and considered in the round. It's once this happens, you're gone. So we might just get some clarity on what is included in an indictable offence. The second one, Minister, and this is my last question to the section chair, it's at the very start of the section, so 21A, where it says the board shall, as soon as practicable, appoint a person recruited in accordance with the Public Service Management Act to be CEO. Would you just run through for us, in practice, what that means? Does it mean that the Public Service, does it mean that the Public Service Appointments Committee or TLAC or some other group comes up with a short list and the board chooses, or does the board get offered one person that they can say yay or nay? How does it work in reality?
Okay. I've been advised that there's a selection process and there is interviews.
And who's the selection process by, Minister?
The PAS organised the selection
The
process.
Public Appointment Service. And do they come up with a short list for the board, and then does the board interview final candidates, or how is it going to work?
Yeah. They come up with a short list for interview.
And the board then interviews them, is that right?
Okay. Okay. I'm advised that there would be a larger interview board, but the board would be representative.
The board be represented. Does the PAS, the Public Appointment Service, do they do an initial round and come up with a short list of candidates for this interview board?
Yeah. Yes.
Okay. And who's the final decision maker? Is it the board, or is it this interview panel that the board is represented on?
Okay. Yeah. Sorry. Okay. It would be the interview board that would put recommendations to the main board.
And ultimately, is it the main board that then decides?
Okay. Yeah, but based on recommendations from the interview board.
Yeah, but does the board, so let's say the Public Appointment Service comes up with 10, and this interview board then interviews those 10 and says, we think the following 3 are suitable. Does the board then ultimately decide which one of those 3 would be appointed?
Okay. 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 I'm advised again that they would rank them in order of
Preference.
the preference, yeah, and the board would have to.
Is the board obliged then to take the first preference?
Yeah. Yeah.
Okay, so the board actually doesn't choose. You see, as I read this reads to me as the board essentially chooses the chief exec, but actually the board doesn't choose the chief exec. If the board is obliged to take the first person, is that correct?
Okay. Sorry. I just want to just get confirmation on this, so I say it right, how it won't be taken down and under the way, okay? Yeah. Okay. Okay. That's right. Yeah. Okay, right, okay. Again, go back to the original question that you asked about the appointment of people, and it is the PAS who would appoint people, and the board, I'm confusing myself now. Sorry, Chair, I have to really be very careful on this, because what I say might be taken down in evidence against me, and I wouldn't like that to happen.
I'm not trying to catch you out.
No, but I want
I'm
to be
just
very
looking for
clear
clarity.
to Deputy Donnelly that
Thank
what
you.
I say is taken and read into the records,
Yeah.
right, and that I can be accountable to Minister Harris when I meet him again. I don't want to be
No, of course.
put my own interpretation on what I'm being advised, Lee.
Yeah, thank you, Minister.
Okay. As you can see, I'm not a legal mind.
You're the gentleman and scholar.
Okay, sorry. Park process. Yeah, I don't think makes the decision. Okay, the board. On the recommendations of PAC, is it PAS? Make the Okay. 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 So the board would make the choice. Okay. Sorry, Chair, for the long delay, but I want to get this right, just in case somebody decides to sue me. PAS process is to have a good and competitive and transparent process following the decision on the people they're going to put forward, and it will be the board that appoint that person. They will accept the process and, I suppose, the recommendations that come from PAS. So I hope that makes that clear. I'm sorry about that.
No, it's fine, Minister. Thank you for taking the time. No, I'm just trying to understand, does the board have any say? As I read this, it felt to me like the board appointed the chief exec and therefore, you know, had a say. If I understand this correctly, though, they don't. The PAS does its thing. They make a recommendation to the board, and the board accepts that person. Is that correct?
That's it. Yeah,
that's how it works.
Yeah, that's it.
Okay. Okay. It just strikes me as odd. Normally, one of the most important powers the board has, obviously. See, the board on the next page, the board is allowed to fire the chief exec. It just seems strange that they don't hire the chief exec. But anyway, thank you for the clarification.
Thank you, Deputy Donnelly. So the question then is that Section 8, as amended, stand part of the bill. Is that agreed? We move to Section 9. The question is that Section 9 stand part of the bill. Is that agreed? Section 10, that Section 10 stands part of the bill. Is that agreed?
Agreed.
Section 11, that Section 11 stands part of the bill. Is that agreed? Section 12, that Section 12 stands part of the bill. Is that agreed? Section 13, that Section 13 stands part of the bill. Is that agreed?
Agreed.
Section 14, that Section 14 stands part of the bill. Is that agreed? Agreed. We now move to Section 15, and there are three amendments in relation to this section. The first is Amendment 22. In the name of the Minister, it's a new section, already discussed with Section 1. The question is that this new section be... Oh, sorry, the Minister to move.
I move.
And it's been discussed with Amendment 1. The question is that this new section be inserted. Is that agreed?
Agreed.
Agreed.
Amendment number 23, again in the name of the Minister, already discussed with 21. Minister to move.
I move.
The question is that this amendment be made. Is that agreed?
Agreed.
Amendment number 24, in the name of the Minister, already discussed with number 21. Minister to move.
I move.
The question is that this amendment be agreed.
Agreed.
The question then is that Section 15 stand part of the bill, as amended, stand part of the bill. Is that agreed?
Agreed.
Section 16, that Section 16 stand part of the bill. Is that agreed?
Agreed.
Section 17, that Section 17 stand part of the bill. Is that agreed?
Agreed.
Section 18, that Section 18 stand part of the bill. Is that agreed? Section 19, that Section 19 stand part of the bill. Is that agreed? Section 20, amendment number 25, in the name of the Minister. Minister to move that amendment.
I move.
Thank you. Do you wish to speak to that amendment?
Yep. Hold on. Sorry. Okay. Section 4H of the Health Act 2004 provides for an audit committee of the HSE. Section 20 of the bill makes amendments to Section 40H to take account of the move to a board governance structure, for example, providing that the audit committee is appointed by the board rather than the directors. The bill currently provides that an audit committee membership is made up of the board members and no fewer than 4 external members. However, the Minister has looked at this further and believes that some amendments should be made. As the HSE is now to have an independent board, it is important in terms of good corporate governance that the board members are now further represented on an audit committee and as part of the audit planning and assurance process. Amendment 25 therefore changes the composition of the audit committee. The amendments provided then no fewer than 3 members of the new HSE board will be on the audit committee. The audit committee will continue to have no fewer than 4 external members. In summary, this will mean that moving forward the audit committee will consist of not fewer than 3 board members and not fewer than 4 external members with the relevant skills and experiences. That's all. Sorry.
Thank you, Minister. Deputy Donnelly.
Thanks, Chair. There's a slight concern with this amendment, Minister, in that it seems to tip the balance very much back towards the board. Now, maybe I'm misunderstanding it, but the Audit Committee is one of its function essentially to be independent external auditors. Maybe I'm wrong in that, but if it is, does it give the board too much say on a body that might be looking at the activities of the board? Now, maybe I'm misunderstanding the role of the audit committee, but that's just my concern.
Yeah, the same thing. It does seem, and I'm not aware of what the rationale is for increasing the board membership, that the board would be over represented perhaps on the committee. That would be my view, and I suppose the Minister can provide us with some assurance there as to why this is a good idea. Might be helpful.
Okay. You'll have to read it again. Oh, okay. I have that page there for a second, just so I can read it. Sorry. My apologies. Okay. Sorry. What's it? Oh, sorry. Sorry, in reply to that, Audit Committee functions are in Section 22 and 13 advisory. These changes are proposed in line with the Department of Public Expenditure Code of Practice for the Governments of State Bodies, which recommend that an audit committee should have an independent, non-executive board members and members drawn from outside of the board.
Would you maybe just give a quick overview of the core functions of the audit committee, Minister?
Okay. Well, it's in the bill. Advise the Chief Executive of a financial matters relation to his or her functions, report in writing at least once in every year to the Chief Executive Officer on those matters and on activities of a committee in the previous year. Provide a copy of the report to the board members and Minister. Audit Committee shall, on after the relevant day, advise the board on financial matters in relation to its functions, report in writing at least once in every year to the board on these matters.
Okay. Thank you. Okay. It doesn't seem sensible. How many members are on the audit committee?
I have no idea.
Yeah, maybe.
Yeah, okay. Right, I'm advised that there can be any numbers, but there has to be 3 from the board and 4 external members.
So 7 as a minimum. It just seems peculiar if the role of the audit committee or one of the core functions of the audit committee is to provide financial advice to the board, including activities of the board,
Yeah.
and 3 of the 7 members of the Audit Committee come from the board, is there not a conflict of interest, or at least a lack of independent oversight, if nearly half, all it would take is one of the other 4 members to side with the board on something? It doesn't feel very sufficiently independent and removed. Are you saying, Minister, that for other state bodies, be it the NTA or whatever, that their audit committees would have 3 members of the board as well? That's the deeper guideline.
Okay. I suppose, well, this board is, I'll just clarify this in my own head first. This board is in relation to the HSE functions. I suppose having 3 members from the HSE board and 4 from external members still very much is in the balance of there is for external members. And I don't really understand why is that a problem for the deputy?
Well, the concern, Minister, is if the role of the Audit Committee is to provide independent auditing advice, financial feedback on the performance of the board, that typically you wouldn't have members auditing themselves.
Okay, my understanding is that the chair of this committee, audit committee, has to be external, and and they don't give auditing advice, and the HSE has its own auditors. Yeah.
Okay.
I'm not really in tune what the deputy is really saying. Are you saying that 3 is too many
Yeah.
from the committee?
Well, I don't know, but it feels unbalanced. So, for example,
if there's 4 external and the chair is external as well, and outside of everything else, that makes 5.
Well, no, it makes 3. The chair would be one of the other 4.
Yeah. I suppose, just on advice again, they can have any amount of external people, but there has to be no fewer than 4.
Yeah. Okay.
I your concerns are around the 3 members from the board. Is that your concern?
My concern is that typically an audit committee wouldn't be auditing itself.
Yeah.
And if half the audit committee is on the board, then it's a board advising itself. And also paragraph 7 says the board may at any time remove a member of the audit committee.
Oh, yeah.
But maybe I've got this wrong, Minister. Maybe it's not meant to be like independently providing advice or feedback to the board. But if it is, it feels like a board kind of providing advice and feedback to itself.
Okay. Sorry a second, just you, Donnelly. No. I suppose yeah, okay, yeah, no, I understand that myself, yeah, okay. I just want to read back on my opening statement, if that's fine for a second, just to clarify. As the HSE is now to have an independent board, it's important in terms of good corporate governance, the board members are now further representative on the audit committee as part of the audit planning and assurance process. It's important to note that the board members are there. The 3 board members who will be from the board on the audit committee will be there to help feed back into the board what's happening on the audit committee. And I'm I have to say I'm confused as to why the deputy would have a problem with 3 of the members from the main board actually sitting on the audit committee, because there won't be an imbalance, if that's what you're trying to say. My understanding is with 4 external members, or maybe even more, and an independent chair, that would outnumber any members coming from the board. And I'm really not sure why the deputy is pursuing this avenue around the provision of the board members. It says amendments provided that no fewer than 3 members of the HSE board will be on the committee. It could be less. I don't know. It could be less. No. But if it says there's no fewer than 3 members from the board, and there can be more external people, I really don't understand.
Well, sorry, Minister, but no fewer than 3 indicates that it could be more than 3.
Yeah.
It could be the whole board, for instance.
Yeah.
Technically.
Sorry. Yeah. Okay. Yeah.
So the external members could be outnumbered by the board.
But there can be more external members as well. Yeah.
Well, okay.
Okay. I understand the deputy.
So the amendment number 25 substitute not fewer than 3,
Yeah, not fewer
which
than
indicates
3.
it could be any number 3 or above.
Okay.
But still with an independent chair and with 4 or more individuals from outside of external members, that doesn't say that, you know, the board would be imbalanced, the committee would have an imbalance, you know. Are you saying, can I just, through the chair, sorry, is the deputy saying that he doesn't agree that not fewer than 3 members should be on the committee from the board? Is that what he's saying? His fear is there could be more. Is that what he's saying?
It's I think the balance that.
Auditing yourself, isn't it, really?
Yes. The original legislation says 1. The amendment says at least 3 or more, I presume, so that the board members could outnumber the external members in certain circumstances.
Yeah, so Minister, the role of the audit committee, right? Function number 1, advise the CEO on financial matters relating to his or her functions, okay?
Yeah.
Number 2, advise the board on financial matters relating to its functions. Now, if the audit committee is essentially a subcommittee of the board where they can also bring on
Board members.
not board members. The board members are there, but it's a subcommittee of the board where they can bring on additional expertise.
Yeah.
Let's say they want actuaries or they want specific corporate lawyers. Okay. But if the purpose of the audit committee, you've already got a board, and the board is talking to the chief exec all the time. The board's job is to hold the chief exec to account, essentially, and to set the strategy for an organisation. They're kind of two of the big issues. Separate to that, you have an audit committee, which is giving financial advice on the functions of the board. It's giving governance advice on the structures, and it's giving financial advice to the chief exec. If the objective is for that to be essentially independent of the board and providing a second pair of eyes, if it's full of board members, then that doesn't happen. It's essentially the board reporting to itself about its own functions.
Okay. Okay. So this is not. So I've been advised, and I'll repeat this, it's not on, not financial advice, it's advice on financial matters and governance, and this is separate to the auditing of the HSE, which is done by professional auditors.
Okay, look, we won't split hairs about whether it's financial advice or advice on financial matters. I think we're dancing on the head of a pin if that's what we do. Could I just ask a final question? Is the audit committee essentially meant to be to provide a level of advice on financial matters and governance matters and so forth is laid out here, is it meant to be providing that independently of the board or essentially as a sub-function of the board?
As a sub-function of the board.
Okay, thank you.
Okay.
Thank you, Deputy Donnelly. So the question, any other contributions on this? No, thank you. The question then is that this amendment be made.
Agreed.
Is that agreed? Thank you. The question then is that section 20 as amended stand part of the bill.
Agreed.
Section 21, that section 21 stand part of the bill.
Agreed.
Section 22, that section 22 stand part of the bill.
Agreed.
Section 23, that section 23 stand part of the bill.
Agreed.
Section 24, that section 24 stand part of the bill. Section 25, there are three amendments. Amendment 26, in the name of the Minister, already discussed with number 1. Minister to move. Sorry, in relation to section 25, Minister, the amendment 26 in your name, it has already been discussed with number 1.
I move.
To move.
Yes.
The question is that the amendment be made.
Agreed.
Amendment number 27, again in the name of the Minister, already discussed with number 1. Minister to move.
I move.
The question is that the amendment be made.
Agreed.
Is that agreed? Amendment number 28, again in the name of the Minister, already discussed with number 1. Minister to move.
I move.
The question is that the amendment be made. Is that agreed?
Agreed.
The question then is that section 25, as amended, stand part of the bill. Is that agreed?
Agreed.
Section 26, the question is that section 26 stand part of the bill.
Agreed.
Is that agreed? Section 27, that section 27 stand part of the bill. Is that agreed?
Agreed.
Section 28, that question is that section 28 stand part of the bill.
Agreed.
Section 29, that section 29 stand part of the bill.
Agreed.
Section 30, the question is that section 30 should stand part of the bill. Section 31, the question is that section 31 stand part of the bill. Section 32, the question is that section 32 should stand part of the bill. Is that agreed?
Agreed.
Section 33, that section 33 stand part of the bill. Is that agreed?
Conditions.
Section 34, the question is that section 34 stand part of the bill.
These have come back as not.
The title then is amendment number 29 in the name of the Minister. Minister to move.
I move.
You could speak on that then, Minister.
Yeah, just the amendment is the long title of the bill and it's consequential to the inclusion of the provision of the health needs and assessment.
The question is that amendment agreed?
Agreed.
So, to say that this be the title of the bill, an act to amend the Health Act 2004 to provide that the Health Service Executive shall be governed by a board and not a directorate, to provide that the Executive shall have a Chief Executive Officer accountable to that board, and to provide for certain other amendments to that Act, to provide for the amendments of certain other enactments, and to provide for related matters. Is that agreed? As consideration of the bill has now been completed in accordance with Standing Order 90, the following message shall be sent to the Clerk of the Dáil. The Select Committee on Health has completed its consideration of the Health Service Executive Governance Bill 2018 and has made amendments thereto. Is that agreed?
Agreed.
Thank you, members and Minister. I'd like to thank you for your attendance this morning. Sorry, did you wish to speak, Minister?
Yes, please, if I could just
Yes.
briefly, just to thank all the members here this morning and those people who have come and gone. I know there's other deputies have been here and I've listened, and thank you for your kindness and I suppose in many ways your attention to me not being really clear on some of the questions that were asked, and to thank both the advisors on each side for intervening on those. And just to take away from the meeting that there's a note on terms and conditions for the CEO to be approved. I think that was one of the things that was asked by either yourself or Deputy.
I think there were a few notes.
Right, yeah. We've taken some notes.
Yeah, there were a few different technical notes to be provided.
Okay.
The indictable offence one.
Yeah, so we will endeavour to have that sent to you as soon as
Thank you.
possible. And to thank you, Chair.
And thank you very much, Minister, and your officials for attending this morning. As we have no further business, this select committee is adjourned sine die. Is that agreed? Thank you.